Hello, I am Dr. Chandrika HS, practicing as an obstetrician and gynecologist at Chirag Hospital, P Nagar Second Phase. Yeah, definitely, because hormonal changes can reduce the amount of the calcium deposition that happens in the bone, and this calcium deposition, if it reduces, the bone starts becoming more brittle. More brittle matlab it becomes like a sieve, like that. So it is easily prone for fractures. So a small injury which is insignificant in your younger days can give rise to a major fracture. This is definitely possible in the menopausal age group because of the hormone deficiency. One thing is general fatigue. Second thing is you will have bony pains. Very common it is bony pains. If you are having bony pains, you just get your, one most important thing I will tell you is in today's society is vitamin D levels are becoming very low. It is becoming very common these days, because in olden days we used to tell that Indians are having maximum exposure to sunlight, and we are not the ones who will have deficiency of vitamin D, because vitamin D production depends on the amount of exposure that we are getting from the sun. But it has become reverse nowadays, and it has become very routine for most of the age group people to have vitamin D deficiency. And vitamin D deficiency also has effect on the bone health. So when vitamin D reduces, bone health also will become low, and naturally its porosity will increase and it will become prone to fractures. Getting fracture is not an easy thing, because once you get fracture, again you will be bedridden, your lifestyle will change, again all your vicious cycle will start, and you will start becoming obese, and you will not be able to maintain your physical activity, and you will not be having proper care about your diet that you take, and these are all the things that happen. So you should keep yourself as fit as possible. So if you want to keep yourself as fit as possible, bone health also is a very important thing that you have to see during your menopausal time. Role of calcium, vitamin D and exercise which is played in bone health. Okay, so calcium is what is the thing that is the hardness of the bone is because of the calcium deposition. When again vitamin D is the hormone which helps in the deposition of the calcium. Suppose you will think that my bones are weak, I'll take calcium. That is not true, because calcium taking unnecessarily is also having side effects, because it can start forming stone in unwanted areas. So when you take calcium, you should see to it that it is getting deposited also in the bone. So for that reason, you have to see whether your vitamin D is alright. So you have to take care of your vitamin D also and calcium also, so that it gets deposited in the bone. And one more thing is exercise. One more thing I would like to tell more, I will more stress on exercise, because our bone health depends more on exercise, that is weight bearing exercise, than what amount of substitutes that you take. In olden days, people used to take calcium and they used to take, I'm taking care of my bone. But that is not true, because unless you do exercise and you expose yourself, that is expose your bones to some stress, it will not deposit the calcium. So most important thing is you have to do walking. In your menopausal age, you have to do walking, because doing walking will take care of so many things. One thing is it will take care of the bone health, and it will deposit the calcium that you have taken. And calcium will be there in your diet also, not that always you have to take substitutes. So if you take calcium unnecessarily, you may go for renal stones, that is urinary stones. So it is not that everybody should take calcium. Without doctor's advice, don't take calcium. And one thing is you have to always do walking. Walking is nothing but bearing your body weight and carrying forward. So this will have amount of stress on the bones, and thus bones will become more stronger. So that is the way of making your bone healthy more rather than supplementing with calcium, taking it orally. Getting a DEXA scan. DEXA scan is what is known as coming to know about the porosity of your bone. That is a scan you have to know, because if you go to your doctor, she will see you, and if you need it, she will prescribe that one, and it is better you get it done, because DEXA scan is one thing which is, there is no invasion, there is no any physical pain or anything when you go for a DEXA scan. You lie down on the table, and it will take the picture of all the bones in your body, whole total DEXA scan. It will give picture of the whole bone porosity in your bones, and it will give the report. So by that time you will know the amount of weakness that your bone has got. One thing I will tell you is, as we age, whether you do DEXA scan or don't do, it is definite that your bones will become more brittle and more prone for fractures. So you have to take extra precautions for that one. So depending on those things only, you have to do the exercise, and you have to always try to prevent yourself from falling, because just a simple fall can give rise to a major fracture in old age. So you have to be very careful regarding these things. So what I tell is, as we become old, it is not that only walking that is most important exercise that you have to do. You can do some exercises sitting at your residence, which will give rise to better health. So because sometimes when you are going to walk, if you don't walk on a proper surface, you may just unnecessarily fall, and a small fall can give rise to a major fracture. So one most important thing in our country is yoga. Yoga, most of the whole world is coming to know about yoga because of what our Prime Minister has brought this yoga day, and whole world is taking advantage of this yoga. And the place where yoga took its birth, there they were getting less interest, and now the Indians are realizing how the Westerners are craving to do yoga. So the importance of yoga is that in elderly people it is more safe. It is more safe for you to do rather than going in uneven surfaces and falling. So more than walking, it's better you do yoga.